Honorable Minister, Honorable Isiak Kunle Salako, Minister of State for Health, Ministry of Health, Nigeria. Dr. Koku Alinon from the Africa CDC. Dr. Alexander Chimbaru, Deputy WHO Representative, Nigeria. Dr. Linda Decker, President-elect, FOASPS. Ms. Njide Ndili, President, Healthcare Federation of Nigeria. Dr. Francis Ohanyido, Chief Executive Officer, West African Institute of Public Health. Dr. Amit Thaka, Executive Chairman, Africa Health Business. Distinguished ladies and gentlemen, good morning. My name is Daniela Monene, the convener of this symposium, the 11th edition of the AHB Symposium series, first time in Nigeria. And it gives me great pleasure to welcome you to this 11th edition of the AHB Symposium. I'd like you to be upstanding as we take a minute of silence to respect the departed His Excellency, former President of Nigeria, His Excellency Muhammadu Buhari. Thank you. Take your seats. I'd like you to scan the code on your screen to get information about the two-day symposium that we're now just beginning. If you'd like to see bios of speakers, if you'd like to see the program, concept notes, and reference material, please take out your phone and scan that code because we want to save a few trees. As you scan, I'd like to welcome the hotel to give us a safety brief. Thank you.
Good morning, participants. You're welcome to Abuja Continental Hotel, the safest, secured, and the most comfortable event center in Abuja. Saleh Mohammed is my name. I'm the hotel safety manager. For your safety and security, we deem it necessary that we should tell you the safety and security protocols as regards the use of this hall. So that from beginning till the end of the program, we will not record any incident. However, before I go further, if there's a need for you to use the convenience, it is very easy to locate. Just walk out through the main entrance door. As you proceed straight, you see the convenience. The door to the left-hand side is for the female convenience, while the door to the right-hand side is for the male convenience. Please, no matter how pressed you are advised to always look before you enter, so that you will not find yourself in a wrong destination. Aside that, today is not scheduled for a fire drill. Therefore, should there be a steady ringing of fire alarm bell for 5 to 10 seconds or beyond that, that suggests that something might have gone wrong somewhere or is a false alarm. However, whatsoever the reason may be, please do not panic. Be calm, because we have emergency response team members on standby to do the needful should something go contrary to our expectation. And should evacuation becomes necessary, we have 2 assembly points. 1, you can exit through any of the exit doors by the main entrance where you enter through. As you pass through, turn to the left, you see the muster point where you are expected to assemble based on your group, because we have other events taking place within the Ladi Kwali Hall. If assembling there will not be possible for whatsoever reason, we have alternative assembly points. You can get there by passing through any of these 2 exit doors. Then you turn to the left, you see a directional sign that will take you to the alternative assembly point. Then on the security aspect, this is a public place, though it's a controlled environment. It is very, very important that your personal valuable belongings, more especially your mobile phone, should not be left unattended. If you have a cause to leave where you are seated, maybe going to the convenience, tea break, lunch, or whatsoever you may have. This is not just peculiar to this place. It's a global best practice when you are in conferences. So please, let us adhere to it, because the hotel will not be liable for either loss, misplacement, or damage of any item. And saying this does not mean that this place is not secured. No. It's just that it is everybody's business. Do your own part. We will do the core aspect of it. And in case you are here not for this program, please, we have 2 advices for you. You either meet the organizers and register your presence properly, or you take a bow and leave. Because the current security architecture of this place may fetch you out. You may even be paraded for others to see you before you hand you over to appropriate law enforcement agent. It is not a threat, it's just a guide, so they will not feel embarrassed later. Then, in case of any medical emergency, we have a clinic on site, certified first aiders. If need arises, you just meet any of our staff who will draw our attention, we'll do the needful. Any medical condition beyond our control, we have hospital just less than 1 kilometer. We take you there for medical attention. Then in case of general emergency, just meet any of our staff. There's a phone dedicated for that. That's 8111. When you dial, somebody will pick and do the needful. So without wasting your time, on behalf of the management, I wish you a successful program. Thank you so much.
Thank you very much, Mr. Saleh. Media team.
Is at a transition with monumental advancements made in infrastructural and economic developments in the Africa is at a transition with monumental advancements made in infrastructure and economic.
Let's do a take 2 of that person.
Africa is at a transition with monumental advancements made in infrastructural and economic developments in the Africa is at a transition with monumental advancements made in infrastructural and economic developments in the
Okay. I would now like to call up the real Dr. Amit Thacker. He's irreplaceable. You cannot make an avatar of him. Please come and make your opening remarks.
Thank you so much, and good morning, everyone. If we do get a chance, it'll be great to watch what AI can do and what AI enabled me to, discuss about Africa. But honestly, um, all protocol observed, I really want to begin by saying, dear friends, thought leaders, respected colleagues, and your excellencies, I'm really delighted because I met Dr. Isiak Kunle Salako today, and he's a real great gentleman, and I'm hoping that our partnership is going to continue in Nigeria for years to come. Dr. Koku Alinon is here, Dr. Alexander is here, Lucy Mazaba is here, Linda is here, my friends Francis and G-Day is here, Mokadi is here, Dr. Philip from Ministry, and so many of you who've traveled from far and wide, not only African countries, but also outside Africa. I see people from Europe, I see people from Asia, I see people from US, and I want to thank each and every one of you because this is really a group of champions. I speak to you today at this pivotal moment in the history of Africa healthcare with deep humility and unshakable conviction. We gather here in Abuja not just as delegates to yet another conference, but instead as master builders of healthcare revolution that will stand the test of time. One particular aspect that I'd like us to do when we leave here is become generational sensitive. We need to make a difference to the generation. And I really want you to focus on the next generation. And I'll tell you why. Because as I look around, I don't just see healthcare delegates. I see defenders of a revolution that will determine whether the 1.4 billion Africans should live in dignity or disease, prosperity or poverty, or hope or despair. Let me move the cursor and tell you about the 1.4 billion. Why is this important? This is beyond process and policies. Think of a rural Malawi mother who would now survive childbirth because of an early diagnosis of a hypertension by a community health worker. It is also about a young woman in Lagos whose cervical cancer would be avoided because of immunization. It's about billions of people that will be lifted out of poverty because of our bold action to make UHC a reality and not just words. Let's confront the staggering fact of healthcare in our continent head on. Look at this. Have a look. And since numbers don't lie, 70% of Africans are under the age of 30. Hence, the world's youngest continent. And yet our health systems, originally designed during colonial times, remain woefully unprepared to deal with the tidal wave of the population growth. Do you know Africa produces great number of health workers, and in fact many specialists. You all know that we produce top-notch physicians but lose close to 20,000 each year due to brain drain. And you've all experienced meeting fantastic physicians in other countries outside Nigeria. Some people also tell me that you find Nigerian physicians in UK more than you find them here when it comes to super specialization. We need to keep those physicians and that health workforce back in Africa. We need to track them. At 38% out-of-pocket expenses, it's a real big dent. It's the highest in the world. And we continue to bear this brunt at household levels. Many of you have continued to support households for contributing towards hospital bills. How many times do you get tapped on because you have to be a social bank? Because the family don't have a cover, whether it is public or private. And they end up looking for funds from their communities and their friends to have their patient discharged. This can't stay. We need to make a difference. It's very important. for us to make sure that despite having 25% of the world's disease burden, just 3% of the health workforce of the world are in Africa. And 1% of the funds for health research are available in Africa. Think about these numbers. Just look at that. Think on the inconsistencies. We have made a lot of progress, but let's be realistic about the inconsistencies that exist in Africa. Although we are not at the forefront, although we are at the forefront of mobile money, and we have many more subscribers on mobile phone, I personally believe today in the digital health session, a lot of that will be discussed. How are we going to use the mobile connectivity to leapfrog better health for our people? But it will come with an intentional program. There are some inconsistencies, even if you look at digital health, and that is 40% of the medical facilities are still struggling without electricity. And solar has not expanded to the rate that we think it should, leaving many people on the continent disconnected. We were the first to use COVID-19 genomic surveillance, but yet we don't have some basic diagnosis systems for breast cancer awareness. Dr. Isiak, one of the most important reasons we are in Abuja, it's because of the historic tie that we all talk about, Abuja Declaration. Everywhere, all of you have spoken about the declaration. This was an intentional design to come to Abuja. 24 years later, let's do a health check. Declarations are great, but what have we achieved and what do we need to do? They keep saying you don't look at the past, but many of you here present will change what's going to happen in the next generation. So are you part of the change? South Africa and Rwanda have achieved good coverage, 2 countries, pretty good. And those 2 countries should come and speak to us. And I know there are people from South Africa here. I also see some colleagues from Rwanda. And prior to the pandemic, global health financing rose by 7% globally, everywhere in the world. When we took all the African countries and put what amount grew in Africa, guess what it was? 20%, 2%. So only the whole world grew by 7% in global health spending, Africa grew by 2%. The repercussions of this is severe. 11 nations spend less than $50 per person on health. 33 African nations have an annual spending less than the price of a single fighter jet. The 15% health spending set forth in the Abuja Declaration has only been met by 6 countries in the last 24 years at one point in the time. Fine. So what do we do next? This symposium builds on the 15 years of intentional progress and sits at the shoulders of giants. We have battled to include private sector in discussions on health policy. What gives me most joy today, Mr. Minister, is that out of the 15 West African countries, at least 11 of them are actively engaging government well. So I really want to give them a big round of applause for the work they've been doing across West Africa. One particular person that I do want to recognize is Njide Dile. If you can just raise your hand here. She's the president of Healthcare Federation of Nigeria. You'll hear her. But being on the table means you're not on the menu. And this is where policy changes are going to shift when it comes to investments and partnership. Through programs such as the Africa Health Marketplace, we have illustrated how creative finance could decrease medicine shortages in Kenya by 60%, reduce Ghana's maternal mortality by 45%, and reduce Rwanda's diagnostic wait times by 80%. And you have seen we continue working on supply chain, maternal health, diagnostics, digital health. We could talk about a lot, but we've selected 6 key items this conference and we've got one of the best minds on the panel. And if we can make a change in those 6 areas, I believe 5 years later, when we discuss statistics, we'll see a progress, and 10 years later, we'll have made a good promotion of health, strengthening health systems for our next generation. The COVID-19 turned into a testing ground, and it really put us on the map. We knew what was working and what was not working. We realized that we have to have made in Africa an intentional policy, whether it's services or whether it is products. As the borders closed, we observed transfer of mRNA vaccine technology established in South Africa. Senegal created a $1 COVID test in 6 months. And Nigeria used AI to focus outbreaks. We were watching you. And some amazing work was being done by many countries. But beyond numbers in the budget, like 15%, the Abuja Declaration needs to extend beyond this kind of measurement to become an action on different financing mechanisms. And let me talk about the new vision of financing. It's pretty simple. There aren't many ways that will get more money for health. There aren't. You can slice and dice whichever way we want. But I think we need to become action-oriented when it comes to bonds for healthcare. If we've done it for infrastructure and we've done it for other sectors, we need to actively design health bonds. These bonds will bring in the much-needed capital into the country for us to strengthen primary healthcare and strengthen the health system at large. We need to also have diaspora investments tapped in effectively. Many people will tell you that the diaspora tapping is haphazard. In fact, to such an extent that about 5 countries in Africa have now created a ministry of diaspora, either integrated within the Ministry of Foreign Affairs or have a direct intentional model. By 2035, we ought to be able to locally produce 60% of the vaccines, cut drug approval from 5 years to 18 months for API production. Why is vaccine production taking center stage? Because it's a test. When we bring vaccine production as a major model of testing Africa, you will find local manufacturing in pharma, and maybe even kitting and diagnosis will become important. So let's set the bar. Vaccine manufacturing is setting the bar. We'll make standards, we'll make laws, and we'll have partnerships that will enable us. So the financing vision needs to be very clear and integrated. Africans should possess a digital health ID and AI-powered primary care diagnostics as we transform the digital health landscape. Mr. Minister, the digital health panel here today will design practical steps and give us a roadmap on what digital solutions we need to provide on a stepwise fashion. This will also lead to another panel that will talk about educating experts. And one area we are talking about today for the first time in our 11 years is climate change. And in climate change, we will be discussing how we can educate 100,000 climate change health professionals by 2030, with the support of establishing early warning systems for climate-sensitive disease. Let us create and sustain a brain gain model through locally developed innovative initiatives such as the Pan-African certification of health workers and fellowships for competitive innovation and diaspora knowledge networks. This certification will give a career path to many. As I conclude, Mr. Minister, in this room, we have funders who can. We have policymakers who can. We have innovators who can. We have advocates and champions who can. And we must hold each one of us accountable for the time we spend here in Abuja. We get that Africa has the potential for health equity. The question isn't whether it does. Whether we'll be willing to think outside our national boxes is the question. Can we overcome bureaucratic complacency? Can we prioritize impact over credit? The world has long seen Africa through its eyes of challenges. Together, we will turn the story on its head to one of solutions, of innovations, of health equity achieved not by generosity, but by the power of the crowd. As I spoke to you about the next generation will come seeking to know what we did when the time was here. Let us answer very simply to them. We will tell the next generation who will hold us accountable, we gazed at the peak. We gazed at the peak, we saw the challenges. And instead of waiting for others to ascend, we began climbing together. Let's climb together. Rather than more reports, by the way, the reports will be important and we share, we should work towards signing agreements. Whether it is vaccine manufacturers, domestic manufacturers, other partners, let's sign agreements. Let's work towards partnering with many people in this room because the champions are here. The second thing is visions for funding health tech startups. Funded visions for health tech startups will be a game changer. If there's one aspect that's going to change us from our traditional health system, it's going to be the health tech startups. How we manage to use mobile money to bank the unbanked, to change traditional banking, this is a promise for better healthcare closer to the people. So healthcare in the pockets is what we need to have. And the third is a clear action for the health workforce expansion. It's critical. And we've seen it all over the world where the health workforce is strong, the costs come down, and the quality goes up. It's a simple formula. So let's go back to basics. Build our health workforce, build digital, and let us work together to create the healthiest Africa the world has ever known. With this, I thank you so much, and I would like to urge you to enjoy the conference.
Thank you very much. Dr. Amit Thacker is the Executive Chairman of Africa Health Business. Among other things, he has been awarded Best CEO by Titan Global. He's the President of Africa Healthcare Federation. He's a board member of Merck for Mothers. He's been awarded the Elder of the Burning Spear by His Excellency, the President of the Republic of Kenya. He has been awarded Best Male Entrepreneur by Rotary International. He's been a board chairman of Kenya Healthcare Professionals Authority. And he's a founder of Avenue Hospital that sees 60,000 patients a month in 14 clinics across Kenya. I was confused by the avatar, so I forgot to introduce him well. And to make up for my mistake, I would like to call on stage Ambassador Dr. Kingsley Amafibe, who's the Project Director, Africa, for 100 Most Notable, to come and tell us about the latest award and award Dr. Thacker. Are you here, Ambassador Kingsley? Please welcome on stage.
Distinguished guests, it's my great honor to be here today. I represent a culture where people are bold and try to take opportunity when they see one. That's my country, Nigeria. And everywhere I travel across Africa, this is what we represent. Now, we start as an organization that represents peace across Africa. And traveling across Africa, I have seen opportunities where we as Africans don't take advantage of what we have. There are so much in Africa that I've been across every country in Africa, and I see there are so much opportunity. But our problem is that we are not united. Now, until we come together as Africans and deal with our problems and offer solutions among ourselves, I think the continent will be a better place. On this note, recently concluded event in Kigali, Rwanda, we listed the 100 most notable Africans who are carrying the flags across the borders. And today we are here to honor one of our own, a man who has distinguished himself. And permit me, please, to welcome Doctor to stage. Thank you. Yeah. Now, the 100 most notable peace icons Africa that draw across people from different sectors who are contributing to society. Now, this event was held in Kigali Marriott Hotel on the 4th to 6th of July recently. So I had to fly in because of this. And it's a honor to have you listed among the 100 most notable peace icon Africa. He deserves a round of applause.
Thank you, Ambassador Kingsley. Now back to our agenda. Dr. Thacker talked about developing the health workforce. And I'd like to welcome on stage the Chief Executive Officer of the West African Institute of Public Health, Professor Francis Ohanyido, to speak to us about innovating public health systems, strengthening workforce capacity and governance for sustainable universal health coverage in Africa. Prof, are you around? Okay. I think Prof will join us in another session. He just completed a 2-day conference. I'd like to call on stage the President of Healthcare Federation of Nigeria, Ms. Njide Ndili, to give us remarks about public-private partnerships driving sustainable pathways to universal health coverage in Africa. Give her a hand as she comes.
Good morning, delegates. Honorable Minister of State for Health, permit me to stand on existing protocols. I must confess, I've had a busy 2 days with the Primary Healthcare Conference, so I don't have a prepared speech or presentation. But what is important is to tell you what the Healthcare Federation of Nigeria is doing, has been doing. I serve as the president. I took over in March of this year. Prior to that, I was the vice president for 4 years, and I was on the EXCO for the past 10 years. This year, we celebrated our 10th anniversary. Now, it's been a long journey, and I am the third president, taking over from Pamela Ajayi, who took over from Cleo Masheye, and I'm really building on, some of the early wins, infrastructure, and activities that we started. It became imperative for private sector to coalesce and speak with one voice. Across West Africa now, there's several healthcare federations, and I think, Amit, you're also involved in that in East Africa. Because we know that in Africa, especially in Nigeria, where I'm from, resources are scarce. We have a country of, I think right now the number is 250 million. And I joke all the time that I wasn't counted. I have 4 kids, they were not counted. And that applies to quite a number of us. So we don't know what the true number is. But that in these times of diminishing foreign aid and development aid, the private sector has a huge, huge role to play. So it's really more around structuring how we interface with government, how we engage government. In the past, private sector was not in the room, but now we have a seat at the table. And I want to go over some of our wins, some of our engagements and what we've done, the impact that we've had over the years, because I feel that at this stage, we have a fantastic opportunity, and government has a fantastic opportunity to leverage private sector's efficiency, resources, human capital, technology, you name it, to better strengthen our healthcare system. So I'll start with first of all, our objective and our mission is really to achieve UAC. So it's no different from the theme here, but using private sector activation, bringing private sector in a formal way into the healthcare system. So I'll start with some of our wins, and I'll start with the most recent one, because Healthcare Federation of Nigeria was integral to the advocacy that led to the presidential executive order on the zero VAT on life-saving equipment and APIs, which was passed not too long ago. I remember when, during the campaign, and HFN was engaged to provide some activities for the then presidential aspirant, President Bola Ahmed Tinubu, for his campaign. Some of the quick wins of what he could do when he comes into office. And this was one of them. So we're very excited that at least we can check something off the box, the list, to say that we contributed to that. Aside from that, Healthcare Federation, in partnership with Roche, I don't know if they're in the room, and PwC, championed the Cancer Health Fund, also with the involvement of the World Bank. Olumide, I think he was also part of it, which is now a statutory deduction in the budget. It's very important that we make these recognitions, but again, I'll say the unfortunate thing was that even though private sector championed it, when it came to implementation, I don't think there's any private sector hospital that is formally in that process. So these, again, are some of the fights that we continue to fight. When after implementation, the strategy started, health was actually not a line item. We actually advocated for health to be taken out because West Africa is a huge market. And we have to organize ourselves and prepare ourselves for open borders. And I think it's very important to also note that. I could go on and on and on. The issue of primary health care centers. I think that's what we talked about for the past 2 days. This is a topic that's very dear to me because I'm fortunate enough as a country director for Farm Access to actually get my hands dirty, implement. We supported Delta State government to implement, a very innovative PPP at the primary healthcare level. We called it access to finance, which could have been the worst name because people thought there was money to be given out, and it stalled in some places because of it. But the impact of that PPP, I can tell you one is zero maternal mortality in the 5 years that we implemented that program in Delta State. Job creation. It also showed us quite a bit of information that government's investment in primary healthcare is not enough to create the kind of impact we want. It's so small. So it's like throwing money into a pit that doesn't really show the kind of results that you need. So these are some of the findings that we published in an impact evaluation, and we shared it. I've also presented to the Governors Forum. Yes, there are still issues around scalability. What is the framework? Because again, the money is coming from the national health insurance schemes through the Act. So it's about government paying private sector for the work that they've provided. And oftentimes that payment is slow. So private sector, there are quite a number of them. And these are credible organizations that have the experience to run primary healthcare centers. And some of them are so frustrated that they're thinking about pulling out for such a program that has significant impact. And I'll give you an example. In one of the centers, it was a center built by Chevron. It was, underutilized, or in fact, not utilized for over 15 years until we activated this center. This is a center that is 2.5 hours one way by boat on the high sea. In fact, I dare to say that it was Tompolo's village, for those who know Tompolo. And when we started, we were seeing 70-year-old boys coming for circumcision. We looked a bit into that and asked, why is this happening? So it turned out that this center, fully equipped by Chevron, everything was in there, still intact. There happened to be a nurse, a midwife, that had been in that community for many, many years. And she was the one doing the circumcision with razor blade. So what was happening is as the children were the boys were being circumcised, a lot of them were dying. So the kids, the babies were no longer brought forward for circumcision. Now, we activated or we engaged a private sector entity all the way from Onitsha, and what he did was really using the model of the oil sector, 2 weeks in, 2 weeks out, the oil man. And that's how he was moving his medical team. And before we knew it, the women started showing up. The babies started showing, the men started showing up to do what is right. But anyway, I think the point of this is that it's not the building that makes the healthcare system. It's the processes, the people, in the infrastructure, everything together that actually makes the healthcare system work. And what we've learned also from this is that really, private sector can be very innovative, especially in hard-to-reach areas. So what is the government's incentive? How do you incentivize private sector to go to those areas? Tax breaks based on their quality levels. We heard from NHIA, the regulator. We heard from LASHMA, Lagos, which is implementing. And by the way, it has been profiled in the World Economic Forum, because this is the first time it's been done anywhere in the world. Anywhere in the world. You can look it up. Where you incentivize a provider based on their quality level. And this is transformational because it keeps the provider on their toes. Lagos State, what they're doing is if you're Safe Care level 5, you get 50% more tariff. If you're Safe Care level 3 and 4, then you get 30% more tariff on the regular tariff that the other providers. And what does that do? It spurs competition. It keeps you on your toes to improve quality. And dare I say that the reason why we haven't achieved any level of, significance in terms of UHC is because we don't trust the quality of care coming out of our healthcare facilities. It needs to be standardized, it needs to be monitored, and that is what we need to focus on. So quality is the arrowhead, and I'm hoping, I see Professor Abiodun here, who is the chair, Tertiary Standards Committee. And I know there's a lot of discussions that are going on, but this is really where we need to take the next step to improve quality. It's a vicious circle if you don't do that. So I will end by saying that, the Healthcare Federation is an association. In fact, we're a lobby group, if I call it that, of all private healthcare associations, but there are individuals that have joined who want to make a difference, who want to push, who want to commit their time. A lot of us are doing this pro bono. We're not getting paid. Only the Secretariat is there to do the work. So please, the Coalition of the Willing, for those who want to support our work, please reach out to me after the session. So thank you very much for, again, I have to say thank you to Amit, who I've known for a long time, for putting this together. Very inspirational. Thank you.
Thank you, Njide. It's so good to hear about how private sector is getting more and more space to engage in policy and health projects. I'd now like to welcome the president-elect of FOWASPS, which is the West African Private Healthcare Federation. And I would like to change the slide if I could. Dr. Linda Decker will speak to us about the role that private sector is playing in innovation in West Africa.
Thank you, Daniela. Thank you, Njide. And Healthcare Federation Nigeria is one of the members. We have an 11-member healthcare federation in FOWAPS. FOWAPS is a regional association of country-level federations. So I think Healthcare Federation Nigeria, being the oldest and being the host federation, gave us an impactful message. I know we have the president of Healthcare Federation Ghana. Charles, if you're here, also wave. So currently, FOWAPS has 11 full members: Benin, Burkina Faso, Ivory Coast, Ghana. I'm from Ghana. Liberia, Mali, Niger, Nigeria, Senegal, and Sierra Leone, as well as Togo. The intention is to represent the full value chain of healthcare service providers, including pharma, manufacturing, insurers, anyone involved in healthcare delivery, bankers. We provide a network for advocacy and policy, provide a platform for dialogue, public-private dialogue, and our interest in access to equitable, accessible, quality care. Our partners within country federations are primarily ministries of health and government, but we also partner with private sector partners. Innovation is the way we respond to change. Innovation is the way we adapt. And as Africans, I think innovation is in our DNA. I have quite a few stories to share in that regard, but I won't. So change is upon us. There are shifts in global health, in the global health agenda. I think this morning there was an elaborate discussion on global security. And this change is affecting access to essential life-saving medicines, access to quality of care, access to affordability, especially to the most vulnerable. So how do we approach these challenges? How do we innovate? And I have two examples from within the sub-region. A member solution, a startup health tech. I remember Amit mentioning that health tech is one of the ways we can approach our challenges. Provides a payment platform that not only accelerates patient care, but provides financing solutions for partners within that network. The unique payment platform uses a code system within a provider network that gives a client access to 100% of urgent care or routine care. So this platform can be accessed anywhere in the world where direct payments can be made to a provider in the sub-region. So FOAPS celebrates this innovation and hopes to scale within the sub-region in partnership with this startup health tech. There's another solution that allows patients with non-communicable diseases, so hypertension and diabetes. And I know Farm Access is in the room. So Farm Access, I ask for permission to share. This solution provides a way in which a patient can lead their care and own their numbers, as well as celebrate their outcomes. The patient will use a point-of-care device, which is a personal device, as well as a mobile app that is carried on the phone, and it's supported on the back end by a registered medical center. I congratulate Farm Access for this solution, and we look forward to scaling also within the sub-region with you. So in the next 2 years, what do we have ahead of us in the West African Private Healthcare Federation? Primary care is our focus. And we focus on strengthening primary care because we feel that this is the way in which we can achieve universal health coverage. I know that it's been mentioned before. So we want to support our members to adopt digital tools. We want to improve the cost of care as well as improve access to patients. We want to improve healthcare infrastructure, support relevant training, and support members to accelerate local pharma manufacturing. This is a conversation that we've started with Auda NEPAD on the 24 priority medicines manufacturing. I know that in individual countries, because of the national health insurance, especially in Ghana, I know Nigeria has it, there's already some amount of local manufacturing going on. So as I quickly round up, the question is, how can we innovate and impact services within the sub-region and reduce the cost of care? We cannot do this alone, and this is why we are here, to dialogue, to partner, to find common solutions, to drive innovation to universal health care. So in conclusion, I want to thank everybody here. I want to thank AHB for this unique platform. I want to thank partners. I want to thank the various ministries. I want to thank the ministers, government agencies, and thank you, Abuja. I look forward to an impactful 2 days of deliberation. Thank you very much.
Thank you, Linda. I'd like to call up our next speaker, and if the media team can change the slide for me, please. Our next speaker is the Deputy WHO Representative in Nigeria, Dr. Alexander Chimbaru. Welcome. Give him a hand.
Thank you very much, Daniela. I can see the action of AI. I don't know how old I was during that particular time. The Honorable Minister of State here present, Dr. Ahmed, the man behind this forum, my brother Dr. Koko, directors from the ministry, entrepreneurs, ladies and gentlemen. It is actually a pleasure for WHO to be participating in this historic event. Let me take you this opportunity to thank the opportunity and honor addressing this distinguished gathering of diverse health leaders, entrepreneurs, public sector champions, global investors. It is actually a pleasure to be interacting with you today. As WHO, one of our DNAs and values is collaborative partnership. That's why we are here today. It's about partnership, where we engage with colleagues and partners to strengthen impact at country level. We do recognize and use the power of diversity to achieve more. To see the seriousness of WHO commitment in this area, the Director General of WHO established WHO Foundation. I have two colleagues with me, Valerie and Vanessa. Their business is to interact with the private sector. That is bridging WHO's work and the private sector. If you could send my colleagues, Vanessa, Valerie. So during this meeting, they'll actually be reaching out to you to say how do we work together, WHO and the partners. It is an exciting moment to be speaking not only about innovation, but about the soul of our shared agenda, safeguarding the health security of our people as the cornerstone of universal health coverage. This is the business where we're here today, of who's bringing partnership together. It is undeniable that health security and EHC are no longer two separate ambitions. They are now two sides of the same coin. You cannot achieve universal health coverage without achieving health security. It is high time we start demonstrating that, and we make sure that we build a health resilient system which will manage all the public health threats which affect our communities. Across Africa, we are facing triple paradox. We are the youngest continent, yet we also have the most climate vulnerable scenarios. Talk about Mokwa, which happened recently, those floods. That's about climate change. We bear 25% of the global health diseases, but our investment in terms of health workforce about 3%. My brother Ahmed has already pointed out that in his presentation. And while we've pioneered a number of innovations, mobile banking, drone delivery, genomic sequencing and surveillance, which has already been mentioned, you realize that we're still struggling to scale that to a maximum scale, which will help us to make things change in our environment. So we talk about scaling up. Scaling up can only happen when you have public-private partnership and commitment from the people in this house today. There is an African proverb which says, you learn how to cut trees by cutting them. We're talking about partnership. We have to demonstrate partnership. We have to walk the talk. If we don't demonstrate partnership with the private sector, then we're not supposed to be here. I want to believe by the end of this forum, we would have demonstrated partnership between the public sector and the various agencies. In order for us to move forward, we talk about universal health coverage. They also talk about strengthening surveillance. Surveillance is not just taking of function. It is the nervous system of public health, the eyes and ears of the health system. Without timely and accurate data, we are not leading. We are guessing and always chasing outbreaks. So we need to know where the data is, where we need to put our surveillance money on. Africa has been remarkable digital health innovations during health crises. During Ebola, we talked about artificial intelligence, telemedicine, mobile health applications, such as mobile contact tracing, drone-delivered diagnostics, and real-time dashboards. These were very popular during the outbreaks, but with time going on, we dropped those innovations. The time is now to make sure that we sustain those innovations and we move with the innovations. From WHO side, we've talked about integrated disease surveillance and response over the past decades. So going forward, we are saying it is high time we digitize IDSR. It has been practiced here. It has worked. Digitalization becomes a component here. But that cannot happen between WHO, Africa CDC, and the ministry. We need the industry to talk about digitization of IDSR and making it happen. I'm happy to say that Nigeria actually embraced IDSR in 2001, and they have been practicing it, and let's help them to digitize and move forward with it. Nigeria Field Epidemiology Laboratory Training Program started some time back. This has actually produced a new crop of detectives to actually identify outbreaks, follow outbreaks. But we are saying, how best do we help them at this juncture to make that our detectives actually do their work from a data-informed position? We need evidence for them to work in the field. When you talk about digital innovation and real-time response, innovations like AI-based outbreak detection, geospatial analytics, interoperable health information systems are game changers, right? But if you look at our systems across the board, we have various blocks, sections talking about malaria, HIV, sickle cell anemia. We need to bring them together. The interoperability part of it requires good innovation so that we use one platform to make sure that we inform the decision makers to take appropriate action. Mobile health technology was used during Ebola. We dropped it. Let's pick it and see how best we improve that. Real-time data collection is WHO way what we call ODK, Open Data Kit, that is being used during polio, during outbreaks. Let's expand it and make it bigger. It becomes part of our DNA as a country, as West Africa, to make sure that we follow this. Genomic sequencing, we trained it during Ebola. We've been using it during COVID. Let's make it a tradition. Let's empower laboratories. The people who can empower laboratories are the private sector. Of course, there's a component of cost. Let's think how do we work together to reduce that cost. As WHO, we launched what we call epidemic intelligence from open sources. It brings information from the communities, right? That is where the action starts from. So how do you capture that information? How do you work together with my brother from CDC, from Africa Union? It is important that let's help our communities to be in a position to detect all the outbreaks and take action accordingly. So there is a component which can make all this happen, is transforming financing.
Sorry. Please, technology is acting up. All right, yes. Whether building a political leadership beyond health that elevates USC to a social contract between the people and the leaders, creating a health system that leaves no one behind and earns the people's trust, enacting strong, enabling regulatory and legal environment responsive to people's needs, mobilizing more and better investment, or ensuring a multi-stakeholder mechanism for engaging the whole of society. Africa must think and act creatively and innovatively if the 2030 UHC agenda is to be realized. Nigeria's commitment to ensure equitable, affordable, and quality healthcare for all, even in the face of emerging threats like emerging and emerging diseases, climate change, and resource constraints, is captured in the Health Sector Renewal Investment Initiative, which is the operationalization of the Renew Hope agenda of President Bola Ahmed Tinubu, GCFR, for the health sector. The Federal Ministry of Health and Social Welfare is making significant strides through initiatives such as the establishment of the National Health Insurance Act of 2022, which makes health insurance mandatory for all citizens and legal residents. In addition, the National Health Act 2014 provides the fundamental legal framework for healthcare service delivery in the country and is being implemented more diligently. A key provision of the National Health Act is the setting aside of 1% of the consolidated revenue as basic healthcare provision fund to improve access to primary healthcare services for all Nigerians through a basic minimum package of health services. Nigeria's slow progress through UHC has picked up in the last 2 years with the establishment of insurance agencies in all the 36 states of the Federation, plus Abuja, and over 15% growth in the number of Nigerians covered by health insurance. Thank you. There's a more robust and transparent implementation of the Basic Healthcare Provision Fund. Government has also embarked on an ambitious PHC revitalization agenda, targeting the upgrade of 17,000 PHC to level 2 by 2027. Our focus is to ensure full national coverage of health insurance by 2030 and adequacy of functional PHCs so that citizens receive quality health care without facing any financial hardship, thereby preventing them from falling into poverty due to medical expenses. We're also implementing the presidential initiative for unlocking the healthcare value chain to boost local manufacturing and availability of essential medicine and other health products in health facilities in our country. And I must thank HFN for being part of that initiative. The President has also issued an executive order to eliminate tariffs, excise duties, and VAT on imported pharmaceutical inputs to enhance the affordability index of healthcare services in our country. And recently, I paid a visit to one of our pharmaceutical manufacturing companies, and they confessed that the executive order has actually reduced their production costs by about 12%. So this is something that we must continue to push, but more importantly, we must ensure that the benefit to the manufacturers is also transferred to the patients. The 12% must not end in the pocket of the manufacturers alone. These initiatives are being implemented using a sector-wide approach to increase program integration, reduce fragmentation, improve transparency, thereby maximizing coordination and cost benefit. Despite the above progress recorded, I must quickly add that Nigeria's drive towards UHC is still heavily challenged, ranging from underfunding, suboptimal health insurance subscription, high out-of-pocket expenses, infrastructural deficit, inadequate human resources for health, which is being worsened daily by health workers' migration, just to mention a few. It is my hope that this symposium will provide a veritable platform towards harnessing and harvesting ideas and opportunities towards effectively addressing these challenges. As we explore innovative strategies towards achieving UHC in this gathering, please permit me to suggest a few pertinent areas for our focused attention. 1, how do we strengthen resource mobilization and sustainable financing for healthcare? One of the most persistent challenges in achieving UHC is inadequate financing. Too often, African health systems rely on out-of-pocket payments, pushing many families into poverty. Thus, African countries must rise to the challenge of increasing domestic resource mobilization, the 15% talk again, for health by exploring innovative funding mechanisms. In Nigeria, we are working to improve budgetary allocations to health, exploring new funding streams, leveraging global partnerships, strengthening public-private partnerships, and I think my sister can confirm that, while reducing dependency on external aid through homegrown solutions. But we must go further. Health must be seen as an investment, not a cost. To this end, we must create the enabling environment for private sector participation while ensuring accountability and equity in the use of public resources. I strongly believe that the African Health Business Symposium offers an invaluable opportunity to galvanize investment from both public and private resources towards shared goals. For us in Nigeria, as President Bola Ahmed Tinubu often says, we are open for business, and we look forward to this symposium galvanizing more private sector investment in our health sector. 2, how do we harness innovation for resilient health systems? Innovation, as we know, is the engine that will drive us forward from digital technologies and artificial intelligence to groundbreaking approaches in service delivery and financing. Africa has a unique opportunity to leapfrog traditional barriers. Nigeria is integrating digital health solutions such as telemedicine, electronic medical records, and AI-driven diagnostics to expand access in our rural areas, to improve disease surveillance and enhance health system efficiency. But this is only the beginning. Digital platforms, mobile health applications, telemedicine, and data-driven decisions must become embedded in how we plan, how we deliver, and evaluate care. 3, how do we invest and strengthen pharmaceuticals and diagnostic value chains? Our over-reliance in Africa on imported medicine and diagnostic is unsustainable. The COVID-19 pandemic acutely exposed the fragility of our health commodity supply chains and the danger of over-dependence on external markets. To safeguard health security, Africa must scale up local production of pharmaceuticals, diagnostics, and vaccines. As stated earlier, in Nigeria, through the Presidential Value Chain Action and other initiatives, Nigeria is committed to strengthening its pharmaceutical industry, supporting indigenous innovation, and ensuring that locally produced commodities meet international standards. We call on all our continental partners to deepen collaboration in this area so that Africa can build a resilient, self-sufficient health economy. 4, how to confront emerging threats such as climate change and future pandemics. Climate change is a health crisis, and it is multiplying the impact in our health system. Thus, we must invest in climate-resilient health systems, expand our emergency preparedness capacities, and strengthen cross-border cooperation. In a world increasingly disturbed by global health threats, ranging from climate change, geopolitical tensions, strifes, and economic constraints, the need for innovative, sustainable solutions towards achieving universal health coverage has become even more imperative and pressing. The journey towards universal health coverage will not be easy, but it is achievable. It demands visionary leadership, inclusive governance, bold investment, and a relentless focus on equity and quality. I am optimistic that this forum will brainstorm and come up with positive and progressive solutions that will support our different countries to achieve UHC in our continent on or before 2030. Your Excellencies, distinguished partners, the path to UHC is clear. We must innovate, invest, and integrate. We must therefore leave this symposium not just with ideas, but with concrete partnerships, policies, and projects that will ensure no African is left behind in accessing quality healthcare. Let us build a continent where no child dies from preventable diseases, where no mother gives birth in fear, and where every African, regardless of socioeconomic status, has the right to health and the hope for a healthy future. And I may build to say that Nigeria stands ready to collaborate with regional bodies, private sector leaders, venture capitalists, and global health institutions to turn these commitments into action. I wish you all a fruitful deliberation. Thank you, and God bless the Federal Republic of Nigeria. God bless Mother Africa.
Thank you very much, Honorable Minister. Thank you. As you take a photograph with the Executive Chair, Honorable Minister, I'd like to request that you sit with us for another hour, because we have a very important session on healthcare financing coming up. Yes. Thank you very much. Just 1 hour? Yes.
He can do 1 hour.
Because we would really want you to listen to financing. Thank you, Amit.